The CEO of Quest Labs telling the Financial Times it will be impossible to increase COVID testing capacity to cope with the demand during the fall flu season. Joining me now is Dr. Jeff Potoff from UW Health. And Doctor, thank you for being with us this afternoon.
Thank you for having me.
Well, we set a record today for the most positive cases. Can you tell us what is your message to the public based on that information?
Yeah, these are really concerning times for us as healthcare professionals. We seem to be setting records, day after day. And as more people test positive for COVID-19, eventually that'll mean more hospitalizations and more people who, even if they recover, may have lifelong disability. And for some of those people who get really sick, they're going to end up passing away. So it's just so important that, we all band together as a community, as a state, and say, we're going to beat this. We're going to socially distance. We're going to mask when we're out in public. We're going to watch our hygiene. And we know from other countries that those things work. We just need to do them.
Yeah, about saving lives. Doctor, what is a possible solution so that labs are not overrun? They're having to deal with COVID testing, but that's not the only health issue that labs work with.
Yeah, I think it's concerning that we're hearing from large private labs that they are finding it impossible to keep up with the amount of testing that we need. And not only the amount of testing that we need to increase, but even the amount of testing that's happening today, which is much better than it was earlier in the pandemic, but isn't enough. And I think it really will require governments looking at the entire supply chain, from the natural resources that are needed to make the reagents to companies that manufacture some of the plasticware that's used to run the test or make the machines. And we're really going to have to dig deep and say, how can we increase our capacity so that we can get ahead of this disease? If we compare this to a war, what we're hearing is that we're running out of tanks and airplanes, and you can't win a war if you don't have the tools to fight it.
Yeah, those supplies are so crucial. Doctor, we're coming on the flu season. I hate to say that, but let's talk about that, how that might affect the testing of COVID-19 for residents. I mean, we all want them to get tested, but how will this work for health professionals and labs around the country?
Yeah, what I think we'll see is that some of these tests that test for COVID right now, they'll become what we call multimodal. So they'll test for other respiratory viruses. So we'll have tests for COVID that also look for influenza and likely RSV, or respiratory syncytial virus. And that will be important because it's not reasonable to expect a patient to know, or even a doctor seeing a patient, whether these symptoms are COVID or whether they're influenza. And it'll be really important to distinguish between the two. So I think we're going to see increased testing or demand for testing that looks at all three of these viruses that are really common respiratory pathogens that will hit us in the fall.
Yeah, I think about it, and this is what everybody is talking about, Dr. Potoff, a vaccine. And we got some encouraging news yesterday out of Oxford in England.
Yeah.
Your thoughts on a possibility of a vaccine, and how soon might that happen for us regular folks?
Yeah, I think the vaccine is the thing that we really are, betting a lot on. We really want to see a successful vaccine. And we've seen, a couple reports of early data. Oxford yesterday was a good example of the AstraZeneca vaccine that, showed, some immune system response, as well as creation of some killer T cells, which is another really good thing to see. We're all hopeful. I think the important thing for the public to know is that we usually don't have big public international releases on some of this preliminary data from phase 2 trials, because it can sometimes sound really promising and then it starts to pewter out as you do larger phase 3 trials. But for the time being, we certainly seem to have some good candidates. And if we're able to do phase 3 trials, I think it's possible that you could see a vaccine early next year. I think the one thing we have to be absolutely certain of is that it's safe, because even if it has, a 0.2% chance of causing a serious side effect, when you're talking about the hundreds of millions of people in the US that would need to get the vaccine, or the global population, even though that 0.2% seems small, that starts adding up to a lot of people that might have a complication. So we just have to make sure that we develop an effective vaccine that's also safe. Those two things have to go together.
Well, you give us a little bit of promising thought, at least early next year. That would be wonderful. Dr. Jeff Potoff, we always appreciate your expertise. Thank you for joining us this afternoon on TMJ4 News at 3:30.
Thanks for having me.